Hello friends, welcome to the MPT Entrance channel, and in this video we are going to discuss about the apneusis and the orthopnea. So when you are preparing for the pulmonary aspect of the MPT exam, it is very much important to understand the different aspect or the different condition or the different diagnosis of specifically pulmonary system. So these words are quite bit confusing, and it may confuse you while you are attending your question, and it may give you a pause for a brief seconds. But again, don't get hesitate about checking the question again and again and repeating the same thing again and again. So while discussing about the apneusis and the orthopnea, let's quite exaggerate this question in the form of this. So in this slide, I have the apneusis, orthopnea, eupnea, and the apnea. So these are the different pnea or the different conditions which are the symptomatic response of a patient when you visit a clinical round or you attend the MCQ. So first we are going to discuss about the apneusis. Apneusis को अगर मैं define करूँ, it is basically a spasm of what? Of the respiratory muscle. So if I am going to discuss a little deeper and down, it have a neurological aspect also. So the neurologists believe that the pontine of the brain is a responsible center which gives this clinical feature when it get affected either by the injury or the stroke or the insult to the higher nervous system center. So when there the spasm occurs, so the patient have a clinical feature, specifically a hungry of air. You heard me right? Yes, the patient present to you as he is or she is a hungry for air. He is gasping the air like he is having a gap in between because of the spasm or because of the insult of the higher nervous system. Orthopnea, to understand the orthopnea, you must have heard about so many times that if the patient rise from the bed immediately, the patient complain of the respiratory infection or the respiratory symptoms. Again, when the patient changes one position, either from the lying or from the standing, very fastly or very momentarily, the respiratory get hampered and the symptoms occur. That is defined as the orthopnea. To define the apnea, a simple phrase by the Rahul Gandhi, bye bye Tata Khatam, is quite appropriate for this condition. In this, there is nothing happen. The patient is unable to breathe at all. That is what the apnea is. And the eupnea, it is quite normal. Everything is well, all is well. So these are the difference between these specifically masking terms which may affect your preparation, but don't let it down.